The conversation, the fireside chat that we're going to have is really about showing the unique parts of Northwell Global, the things that we do super well, that people have really shied away from doing. Nobody addresses global mental health in terms of service delivery. How do we take care of patients with mental health issues? That's a problem that's daunting in the United States. We're addressing it globally. How do we take burgeoning health systems and help them integrate telemedicine into their system? Well, we're still trying to figure it out as a country in the United States, how that's going to integrate into our model. We're being bold in that space. We're trying to innovate with countries like Ukraine and Guyana and Ecuador. And all of these little seeds are, I think, on the shoulders of giants. We started late with the Center for Global Health in 2019, and we learned from 30 years of mistakes that have been made in the global health space, and we're able to start a center that had the right combination of aspects that we're going to make it successful. And this fireside chat is really about how do we partner with the right people to really accelerate that, to take those starts, those seeds, and grow them into something vibrant that we can really be proud of. In the same way that we're innovating all across New York State, we're innovating all over the globe. And I want someone to be a part of that and get as excited about it as I get. As far as an update in Ukraine, I'm really excited to say that we actually were participating in a mental health conference in Prague that was really ignited by the First Lady of Ukraine's roadmap to mental health. And it couldn't come at a more opportune time. Ukraine is in a state right now where pretty much everybody has some sort of traumatic experience that they've lived through in the last 14 months. And we need to be respectful of that and understanding of that, but we need to make sure the services are available, not only post-war, but that we start building that up now, proving concept now and piloting it. So when the international community runs in to help Ukraine rebuild, we've already got the skeleton of a great mental health care model that built on the back of the rest of our telemedicine model, which serves trauma, orthopedics, pediatrics, and kind of all those other medical needs. All of this is kind of the seed of greatness that, if we partner with the right people, is going to change the world fundamentally. We're at pivotal moments in many healthcare systems and countries where they're making decisions right now about how they're going to future-proof their populations. And a lot of these countries are in transition, whether it's Ukraine, which hopefully will be emerging from a war soon, hopefully will no longer be in a conflict, whether it's Guyana, which is making a huge economic transition from having multi-sector, very small-scale economy and exports to having a major export and having kind of Qatar or UAE-style kind of income from oil that will help elevate the entire population. They're making really key decisions right now that's going to affect generations of Guyanese, generations of Ecuadorians, generations of Ukrainians on how they build this healthcare system. Our initial trip to India, revisiting for the first time since the pandemic ended, was to Christian Medical College in Vellore, India. They're a new partner for us. We're really excited about them as a partner because they, in many ways, mirror Northwell Health in terms of their footprint in India, in terms of their prestige and kind of their impact on Indian health and public health. Their director, when we were meeting with them, had very similar statements to my CEO and saying, we do things that are unpopular because they're the right things to do. And so in COVID, when every Indian hospital was looking for ways to take less COVID patients, they declared, we're a COVID hospital. Send us your COVID patients, we're going to take care of them. Because they knew that this was going to be an issue that was going to affect everyday Indians and would honestly result in whether more people died during this pandemic or not. Even though it was a time where, profitability and for other reasons, it wasn't a great time to be advertising that you were going to take COVID patients. They knew it was the right thing to do and did it.
We as a healthcare organization have to be concerned about people in other parts of the world, and if we have the ability and the resources, and we obviously have the will to help, then we should help. And that's why we are in the healthcare business. We can't just always be looking internal, we got to be looking external.
Everyone is just interested in collaboration, but very proud of what they've done. And so it's a very equal footing that we're having these dialogues on medical education, on nursing education, simulation medicine, cutting edge technology. It's all really a conversation about how do we help one another. If I had to boil down the two things that we do that are very different in this space is, number one, our projects are stakeholder-led. We ask what the problem is, and we focus on what they think the problem is, not what we think the problem is. That's number one. Number two, every action we do is a sustainable action. We're trying to make sure that this isn't like a one-off donation. This isn't a mission trip where we go down, we fix some hernias, and we come back. That's not the point. You have to fix the systems, and there are people working in all of these countries trying to fix fix the systems. And what they need are an advocate, and they need some technical expertise, and they need some attention. That's what Northwell helps do. And all of our support is designed to be multi-year sustainable action.